And I'll get the title slide loaded here.
Perfecto. We are live and loaded. We're ready to rock and roll today here on another great webinar and training and mastermind meeting here at Heads Up Health. So we'll be loading our slides here in a second. If you're on early, again, we welcome you. Please go ahead and introduce yourself in the chat box. Let us know where you're at in the world and the type of work you're doing. Looks like Tom, Jeffrey, Jameson are on with us. Of course, Chuck from our team. Hey, Chuck, thanks for being here. So other than that, we can go ahead and probably get started here. As you can see, today's presentation, we are talking creating and validating protocols with the power of templates and data. We're excited to have you. And we've got an awesome special guest here as well. So we can go ahead and transition. Dave, if you want to go ahead and welcome everyone and give a quick intro, and then we can share a little bit more about the backstory and the intention of today's presentation.
Yep, great. Thanks, TJ. Hi, everyone. Dave Korsunski, and founder, CEO here at Heads Up. We're going to go into more detail on creating and validating protocols using templates combined with objective data. So just a bit on the agenda here. We'll do a quick round of introductions. For those of you who are getting our emails, you've probably seen TJ's name and Nikki's name and Dr. Lemansky's name. So we'll do a quick hello. Everyone can say hi and introduce themselves. John and I are going to talk a little bit about the different types of implementations out there for doing notes and protocols. EHR systems, practice management systems, coaching systems, they all have some flavor of this. So we'll go into our specific implementation and why we designed it the way we did. I will do a quick demo for anyone who hasn't seen this yet. I think it just went live about a week ago. So I'll do a quick walkthrough just really to set the context for our feature presentation, which is going to be Penny Burciaga from Ben Greenfield Fitness, and TJ and Penny are going to talk about how they specifically are able now to combine the notes and protocols with the objective data. Objective data could be lab test results, it could be heart rate variability, it could be blood sugar. So how do we combine those to get the best of both worlds? Penny has some amazing examples, and we'll do some Q&A, closing remarks. Nikki is going to also take questions in real time, and we'll answer them as they come in, just to try to keep it a little more engaging. So fire away. And with that, we'll do quick hellos. John, you want to start? Quick background on yourself and a hello to the guests here.
Sure, yeah. Great to be here with everybody. So John Lemansky, I'm the Chief Medical Officer at Heads Up Health and practicing physician internal medicine. And I do health, wellness, prevention, medicine. I'm an actual clientele of Heads Up Health, and then I joined the team as the Chief Medical Officer to try to build up kind of the practitioner side of Heads Up. And Dave and I will go through a little bit about what we've developed, what we're looking forward to in the future with Heads Up, and how we can implement all the data that we have into actual, functional medicine practices, health coaches, and really present the data in an aesthetic way.
Thank you, Doc. Nikki?
Hello, everyone. My name is Nikki. I have a strong background in health, wellness, marketing, and I joined the team a few months ago to help with the sales and marketing strategy and do a lot of community building as well. So you've probably seen lots of emails from myself.
Mr. TJ.
You bet. Hello, everyone. If we've connected before, excited to be here again with you. I help lead our sales division and new accounts. So working with a lot of our enterprise, our white label accounts, we have the option for you to customize your own portal and get your own branding in our system. So just excited to be here. I also have a deep background in behavior change science, health coaching, and biohacking. So really excited for today's presentation.
And our honored guest, Penny. Thank you,
guys.
Penny.
Yeah, so happy to be with you today, and I'll be sharing how we use notes with the Ben Greenfield coaching team.
Awesome. So I guess we'll just transition to John here. And John, we've been working on this for a while. You and I, you've, I think, in your own words, have used 40 or 50 different EHR systems. They all have some implementation of this. Just from my own background, when I was working with a functional medicine practitioner remotely, in this case, I was working on a thyroid protocol. And I remember the functional doctor would send me the protocol in a Word document through email. And I would have to print the protocol off and keep it in my kitchen because it was a very specific supplement protocol. And then we would run the labs every 3 months. We'd run a full thyroid panel. And we were working on some reverse T3, TSH stuff. And I had to keep the blood test results in a spreadsheet because they were in about 7 different PDF files from Quest. So that's actually still where a lot of practices are in this stuff. So that was my own experience. And then we'd get on a Skype call and I'd share my screen with the spreadsheet and we'd look at the numbers and another protocol. So suffice to say that was not so efficient. And then as we've been building this product, we've talked to hundreds of practitioners, and there was something interesting that came up pretty consistently, which was the fact that we talked to a lot of practices who still have some antiquated EHR system, whatever that, there's thousands of them on the market. And when we probe a little deeper, it turns out they've got all of the client data in Heads Up, but they're still using the EHR kind of mostly for notes. It's primarily it. And so they've said, man, if we could just combine that, it would be extremely helpful. And we heard that very, very consistently. So this has been on our roadmap for a while, but I would love to hear your experience, John, because you have years in the conventional medicine setting, inside hospitals, inside traditional medical practices, using SOAP notes for conventional applications, prescribing, submitting insurance claims, documenting internally in the EHR. But the other side of your practice is health and wellness and biohacking and health optimization. So that's where you would use notes and protocols to, for example, prescribe a nutrition modification instead of a medication, for example. So maybe you can just share on your experience on both sides of the table and how you've informed that into the way we've addressed this notes and templates feature.
Yeah, sure. That was a great intro from your experience. And I think probably a lot of people on the call or who will watch this later will have a similar experience, either from the practitioner or the actual client. So I kind of would step back first and look at this big picture, kind of what do we see Heads Up Health becoming? And we want to be what we think the future is, which is a one-stop shop for everything that you need as a health, wellness, even traditional medical practice, right? Because if COVID has shown us anything, it's that this transition to the virtual kind of wellness practice is here to stay, and it's only going to accelerate. And so, from my background as a hospitalist, internal medicine doctor working in a hospital and clinics, each facility that you work at has a different EHR system that doesn't talk to any of the other EHR systems. It's the most antiquated way of practicing medicine. And a lot of countries in the world have one system and everybody uses that system. But in the United States, it's not that case. And so, from a traditional medicine perspective, the whole focus of that EHR system is documentation, because documentation is what triggers whether or not you can bill for a certain level of coding. And so we get hammered. We probably spend more time in documentation management than taking care of patients. And I'm glad this is being recorded for the world to see, but that's the truth. Like, we really spend so much time, we get hounded, did you think about, documenting this because we can bill extra, et cetera. Not the 2,000 extra that doctors are making from COVID, but like real billing stuff. But as I transitioned away from just traditional medicine into more of a wellness practice, I kind of ran into the same issues as Dave mentioned, where I was on the other side. So I had 100, 150 clients sending me all their lab information in PDF files. And then I would have to create spreadsheets to keep track of it, very much like what Dave was talking about. And I probably went to medical school because I didn't have to do Excel. I mean, I hated Excel. And so it's kind of like this throwback to, you know, high school, where all of a sudden I have to learn how to keep track of all this stuff. And it's, for me, Heads Up Health was a way to at least have a way to track all the data, but it still didn't have the ability to actually document. And I think once we started talking about really building up a platform for practitioners, for wellness coaches, we really realized that that's an essential part of the business, but also the documentation, the presentation is really kind of your representation to your clients. You know, after you've talked to them, the next thing that they get is this, you know, this is my protocol, this is my PDF, this is how you're going to have a client come back to you and say, wow, I'm really impressed with not only, you know, the conversation, but also the protocol. And so we realized that we really need to build up that part of our platform and make it accessible to our client base.
Awesome. Thank you, Doc. So what I'd like to do is just walk through a couple examples of how to use this new feature. Again, for many who are either currently on the system as a client or prospective, it just came out. So I'll just walk through a few really, really simple examples. I don't want to take too much time here, but just to level set on what the feature is, how it works, and then it will help to set the foundation for what Penny is going to present. So I'm going to go ahead and share my screen here again. You guys could just let me know if it loads okay. Should be good to go. So just a quick overview. This is the clients table. I've got a small handful of test clients here, and we keep all of the biometric data front and center. So I'm monitoring heart rate variability, blood sugar readings, steps. These metrics are completely customizable here. So not much has changed. What you will see now is the notes section on the left here. And that's going to give you a complete list of all notes and templates that have been deployed. And you can filter this list. It's very easy to come in here and filter by client, or to filter by tag, or to sort by date. So think of this as a comprehensive list of all notes. The templates are created and managed here. And I've got one that I'll be using for demonstration purposes, but the notes section here will contain a full list of everything. You can also access the notes on a specific individual just by clicking on their name from the clients table. And a couple UI changes here. You'll now see the notes in this tab here. So I've got a couple that have been assigned to this specific client, but at the most basic level, it's just documenting an internal free-form note. So create a note. I can create it from an existing template, and I'll show you how to create a template in a second, or I can just create a blank note. And this is pretty straightforward. There's nothing fancy here, but the most obvious use case would just be recording visit notes and keeping some internal records of what happened or what was discussed on a specific consultation. So nothing particularly earth-shattering here, but this just allows you to create internal documentation, exactly like Dr. Lemansky described. And once I have it just the way I want it, I can preview it, I can save it, and it's then just a completely internal note for me only on this specific client, and it's here. And if I then want to share that with the client, I can. I may want to edit it before I decide to share it, just to make sure that everything is presented the way I want. And you can attach images, you can attach photos, you can attach links, videos, et cetera, et cetera. So you can get this exactly the way you want it, and then go ahead and share it. And I'll click yes. Your client will then receive an email, and the email will let them know they have a new note available. And they'll actually see it when they log in. So when the client logs in to the patient portal, they now have the coaching notes here in the patient portal, or the client portal, whichever term you want to use here. But they'll see the coaching notes here. They'll get an email, and they'll have access to the notes here. So it's a basic example. Just wait for that to load. I'll show something a little more complex, which is really what we want to emphasize here, which is how do you start to integrate some of the actual biometric data into the notes and the protocols. So that example I described before, how do I know if the reverse T3 marker is improving, or if my blood sugar readings are coming down. So what I'm going to do in this case is I will go into a specific client's account here by clicking View Dashboard. And let's just use an example of wanting to send a progress report on a specific individual's blood sugar. Pretty common use case. It may be for an RPM code. It may just be for providing follow-up. So now I'm in this client's profile. I'm just going to run a report on 30 days of blood sugar data. This client happens to have a Dexcom, continuous glucose monitor, but whatever they use, even if they're punching it in manually, the data will be here. And I'm just going to run a report month to date. And I've got the data here. So you can get this exactly the way you want. You may want to put other metrics on there, like deep sleep, steps, physical activity. I'm just going to keep it simple. And I've got the blood sugar data from the current month. And then down here, we're comparing it to the prior month. So very quickly, I can see this individual has seen a 3.3% reduction in blood glucose data. And I'm going to just generate a PNG image and save it down to the computer. Now I want to attach that to a note and provide some positive feedback on this individual's progress. So just like we did before, we would create a new note. This time I'm going to attach the actual objective data. And so I'll go back to this client and I'll create a note here. I'll just use a blank template. And this could be a blood sugar progress report. Again, just as an example. And I'm going to attach an image. I'll just pick the PNG file I just created. So now we're starting to get interesting here. We're taking the objective data, the hard data. This could be anything that a client is tracking. And I may actually want to resize this a little bit. So let's just drop it down to 1,000. Here, center it. Provide some positive comments. You know, down 3.3% this month. Whatever the case might be. Again, preview it, save it, and share it. And now we're starting to integrate the objective data in with the notes and templates, and that's where it can start to get interesting. First of all, just for tracking progress, you might need to tweak the protocol for someone if the numbers aren't moving the way that you want them to, or it's a good opportunity just to show them how much progress they're making, because it can be easy to forget when we get into the thick of it. And then the last part is creating a template. And this is where you can just set up repeatable documents that you want to use every single time. So you may have a template to record specific information after every visit. You may have nutrition protocols, workout protocols. This is just a test. It's a sleep protocol here. But I've set this up, and if I want to share it with an individual, I can just share it exactly as is. Or for a specific person, I may make a few changes and then send it off. I've got different sections here. I can include links to resources, gear, specific protocol information, and I can just deploy this very, very quickly. So this is where you'll build up your library of protocols. And that just helps to save time. It helps to keep all the communication centralized. And it just gives you some really easy ways to take the objective data, combine it with the notes and the protocols, and that's where it starts to get fun. So that's the feature in a nutshell. I'll turn it over now to Penny and TJ to talk a little bit about a real world example of how to use all of this information together. So TJ and Penny, I'll turn the controls over to you.
Sounds great. Thank you, Dave. Great little overview and of showing everyone just exactly how simple and how powerful this new feature can be, especially when combined with our already existing features. A lot of you may already know about where we shine in terms of bringing in all the data, doing the analytics, as Dave showed, being able to download and create PDF reports and integrate into that protocol and that note. So now I'm excited to have our special guest here who we've been working with the last few months. Penny, it's awesome to have you. We're going to be exploring just exactly your intention and the value and the importance of notes and protocols, and how you all use those in and around the Ben Greenfield coaching practice. And so I know you've got some great slides and some great tips and guidance for people around understanding the value of this feature. So we're excited to have you. So I'll go ahead and pass the ball to you and welcome you and allow you to take it from here.
Okay, great. Just double check you can hear me and see my slides. Okay, right?
Exactly.
Okay.
That's great.
Okay, well, yeah, I'm super excited to share with you just our journey with Heads Up Health, because it's been a great one. When we first came to Heads Up Health, we had this problem because, as you know, the current and future health and coaching space is filled with so many variables and so much to track. And when we started out, we had 4 to 5 different apps that we were using, and that doesn't count all the different platforms that we were logging into to check on labs. So our clients' phones pretty much looked like this, as well as ours, and it was one big hot mess, let me tell you. So Heads Up Health to the rescue for us. We went from that hot mess to this very organized and systematic platform that really made things so much better for us. When we got on board, this simplified our tracking for our clients and for us, but we still had the issue of delivering coaching content in one place. And with the innovation of the notes feature, we are now able to deliver content directly applicable to all the wearables and biomarkers that are being tracked in Heads Up. So this notes feature adds tremendous value across the board for not only the clients, but also the coaches. So some of the benefits of notes, and I'm going to talk a lot about templates, because for templates, it's one and done. We're adding all of our various client protocols as templates. So all we need to do is apply that note to the client, add their personal information and any custom notes, just like Dave showed you a minute ago, and we're done. It's so much easier. This is a huge time savings for us, and we will ultimately be able to scale our program so much bigger because of this one added efficiency that has really transformed our coaching system. So we are able to keep track in one place, all the notes and protocols to all the various wearables, and we can make comments with, instead of going to all these different apps that we had, it's all within Heads Up. This is so much more efficient and way less frustrating, as you can imagine, for the coach and the client having to log into all these different app platforms. One really nice feature is the ability to organize by categories, because I think when we're done getting all of our materials and content into the templates, we're probably going to have hundreds of templates, and we're going to be able to categorize those and just boom, like get to exactly where we want to go and get that information to the client. This allows for that seamless delivery to the client, because they can get that email that says you got a new note, and they can get busy on those action items that we send over to them. So again, this makes it to where we are delivering prompt service and being very responsive to those findings that we see in the health insights.
Hey, Penny, may I jump in with a question?
Perfect. Yeah.
Could you give us an example of one of the protocols that that you would deploy, whether it's nutrition or sleep optimization, or because you guys are in the health optimization space. So maybe you could just pick one of your favorites or one of the most popular and share a little bit about what it is and how you use it.
For sure. I have in one more slide. I'm going to go over that.
Oh, I'm one step ahead of you.
Right on time.
Well, just a sec there. So one of my favorite things about the notes, again, templates. I love them. This is where the time savings power really lies in delivering this notes feature to your clients. And just practically, we all want our content to look stellar, right? We want it to look professional and like have nice headings, be able to like do all kinds of things with it. And you can definitely do that as far as the notes go. And again, I mentioned the categories. So it allows for that seamless delivery. And I also mentioned, well, I mentioned that adding the infographics and pictures, all of that can be added in that notes feature. So your notes look stellar. I mean, they look like, wow, this is amazing to have all this beautiful content delivered. I mean, really the sky's the limit with whatever you want to do there within your notes. And my favorite thing about the notes feature is that we are engaging the client with actual solutions within the Heads Up interface. It's not just tracking. We are now giving this trigger to the client that says, hey, I'm going to engage with my data. I'm going to do something with it. It makes it come alive to them. And that's just really, you know, something I didn't really anticipate or expect with the notes rollout, but it's really a phenomenal thing that happens when the clients are literally engaging with their client or in their content in taking action, right? We want them to take action. And the internal and external notes, of course, is so important. So you can make notes about what you want to cover with your client on their next appointment, or the progress notes, keeping all that in one place. So here we go, Dave. Here's an example. So uses for notes. On the nutritional side of things, we are actually delivering meal plans and food lists in the notes. So this is so helpful for our clients when, you know, they're on vacation or out and about at a restaurant. They're going to have their food list through Heads Up right there, and they'll still be able to see their glucose and all the ketones and all of this, but like, hey, I got my meal plan right here on my phone. And that's like super exciting for us to have that be so functional in their lives. We also deal with a lot of fasting protocols. So we can look at their fasting hours and their dashboard and think, oh, maybe they need a little bit more help or support in this area. So we can give them different protocols to help them along in the fasting process. Or give them, you know, feedback on their diet, right? So let's say they're using the Keto Mojo. We're monitoring their ketones and the Dexcom, for instance. These are all ways that we are monitoring their data, and then we're responding and supporting the client by giving them feedback through the notes. So this is like real time. We can like help them out, you know? And that's just a great way to use it on the nutritional side of things. Another way, let's say my client Joe is using the Oura Ring. And most of our coaching clients do use the Oura Ring, and we're looking at their sleep data, and we're checking their HRV. And let's say Joe's HRV is in the tank day after day, right? So I need to provide some help for Joe here. So
Joe's been drinking too much, not telling you.
Yeah, he's a little stressed out. So I might determine that I need to deliver a meditation protocol or some kind of other stress relieving protocols. And I can do that right in the notes. So again, the client knows that I'm paying attention, I'm being responsive, and again, they're going to be more engaged with their data.
I want this protocol. I'm looking at it now.
Sign up for coaching.
HRV hacks.
Okay, and then we mentioned lab work earlier, right? And this is another solution that Heads Up provided us, because we were logging into all these different platforms or waiting on clients to get us their labs, and it was a pain in the you know what, right? It just delayed us from being responsive to them. So now we have our clients in Heads Up. We got their lab values being tracked there. We've marked which ones that we want to track that are issues. And so let's say my client, Rachel, I notice on her lab dashboard that she has low B12 and she's anemic, right? So based on her known food plan, which I have in the notes, I can make immediate changes to her nutrition plan and supplementation plan, and and also like make internal notes to myself that I need to get these retested in 3 months, or I need to like check on these various values, make sure she's sticking to her food plan. Like this is all the things that the notes have allowed us to branch out and really support our clients in a new and innovative way. So I can't speak highly enough for it. I know I sound like a saleswoman here for the notes, but I truly believe it and I see it taking place, and there's so much potential. The other thing I want to just clue in on is the continuing education, right? So all of Ben's blog posts, social posts, all this great information that we have out there, we're going to be adding that as a template. So that way we have all this great information we're already putting out there, but why not deliver it to the client right when they need it, right? When we see different levels that are off in their labs, or they're, you know, different wearables are showing us through the health insights that we need to address certain findings. And this is going to allow us to do that.
That's really cool, Penny. So you're using it as a way to make it easier to share new content, and you can create an article and share it with all clients or select clients, but that means they just don't have to go search for it. Maybe they missed it. So you're using this as another content delivery mechanism. Do I have that right?
Exactly. Yeah. And of course you can store documents and organize documents in many different ways within Heads Up, but you know, I can just link those now to different protocols that I need a client to work on various things, and we're addressing them. Where, you know, it's adding so much more value really in every area to the coaching. So just in conclusion, just this innovation of Heads Up has not only simplified and made the delivery of our coaching services more efficient, but the notes has turned Heads Up into more than a tracking dashboard. It's a means of supporting and engaging our clients with prompt solutions that add value to the client's program, and that ultimately yields greater success, not only for them, but for the coach. Saves us tons of time. It makes everything so much more valuable. So onward and upward, guys. Thank you for creating this. And I'm so excited it's getting rolled out to the rest of the health tribe so we can help as many people as we can.
Awesome.
TJ, ready for you to take it away, man.
Oh, amazing, Nikki. I'm sorry, Penny. I was looking at Nikki on the video. Thank you so much for sharing. And it's like you said, once you get all the content in there, it's not just typical programs and protocols. It's also a tool for continued education. As you mentioned, this content delivery system, it's gold. And it is a process of getting the content in there. But so in terms of getting used to this new feature, we can share more about that. And there's already lots of how-to videos inside of our portal to give you guidance on creating notes, creating templates, but you'll be able to house all of these templates and they look professional. You have your branding on there. And one other thing I think to highlight, you mentioned to help scale your business in terms of time saving, but also for revenue growth. I know one of your other interests, Penny, and the whole practice around all of Ben and his coaches is having different links in there for different products that you promote and want your clients to purchase to help improve their health, right? So you can hyperlink any affiliate link that you have with any products inside of our notes and use that as an extra way to generate revenue. Yeah,
for sure.
Cool. Awesome.
A question here from David Heitman, who's asking if we plan to allow practices to share certain protocols, which I think is an incredible idea because we all have our domain expertise. And so if someone did have a protocol that they want to share with the community to another practitioner that maybe they don't know, we do intend to have a public repository. We're also going to start providing some of our own templates. So we're working on some of them now where you can just, for example, come in there, fill in the blanks to for example, submit a specific type of claim or whatever the case might be. So yes, David, we're on version 1 of this implementation right now. This is the first set of features we've rolled out. We've got a bunch more coming in version 2. We're going to make it easy just with keyboard shortcuts to import 30 days of blood sugar data or 30 days of, so that's going to further integrate the objective data with the notes just with simple keyboard shortcuts. Having the ability to share a protocol with another practitioner will be incredible. A public library of those would also be incredible. We're also going to extend it down to the client side, because they may want to record notes and share those with you, specifically if they're tracking a symptom like seizures or migraines or something that is an intermittent issue, and they can just create that quickly and document the circumstances around that and be able to share it the other way. So turning it into a two-way communication also is on the roadmap. So much more to come there.
And Dave, just to jump on that, you know, we're HIPAA compliant. And so for some of the practitioners who are new to us, you have to really be concerned about, you know, are you going to be compliant with all the data that you're sending back and forth through email, text messages to patients? Through our system, you can be, you know, aware that it's HIPAA compliant, which I think gives people a sense of ease that their data is not going to be shared, you know, on the interwebs as you have it. And especially now with, you know, personal data being such a kind of target point of people not being too happy with their data being shared, ours is going to be, you know, very, very secure.
So no more Google Docs needed or whatever source of creating documents that are not safe and secure. That is such a great extra point, John. Glad you mentioned that. I think we're still taking more questions, right?
Yeah, I think we can also just share some summary points here. How are we doing for time?
We're great.
All right. 1 second here, guys. Just wrap it up here. So it's really about it. It's a simple way to save time, deploy content, increase engagement, validate protocols. I mean, you're not just sending someone a protocol and saying, go buy these supplements and do this and that, but now you actually have the objective data to show them that what they're investing in with you is going to meet the exact outcomes. And that creates tremendously powerful ways to retain, especially if you're continually delivering value. So lots of ways to apply this. If you are not on our system, just head over to our website and sign up for the trial. If you are on our system, go ahead and log in, and you'll see information on everything on how to use this feature is in the tips and tricks section here. So everything we talked about on the demos and much more, TJ and Alex and the rest of the product team have created tons of tutorial videos to help you get started. So if you're a current client, go ahead and kick the tires on this. We'd love to have any feedback, any suggestions on stuff we're going to add in version 2. So have at it, enjoy. We've got a lot more coming on notes and protocols, and a lot more coming in the platform as well. I don't want to divulge too much, but we've got some big integration in next couple of weeks, so stay tuned for that. And Nikki, anything else in the Q&A here we want to cover, or any parting shots from our other panelists here? Penny, John, Nikki, TJ?
Dave, just new question came in from David Heitman. For Penny, how many people per coach can you handle? So a question around like design and model and capacity for your coaches, if that's something that you want to speak to.
Yeah, we're actually rolling out a new coaching program the first of the year. So I don't really have those numbers right now, but I don't know, Ben probably does 12 to 15 with his very busy schedule a month right now, but we're going to be expanding that to our coaches. So stay tuned on the number, but you can always email me. It's penny@bengreenfieldfitness.com if you have any questions on that in the future.
Awesome. And I did put a link if you haven't used our system yet, if you're not a current client, you can learn more about us at our link at headsuphealth.com/professional. That link is in the chat box. And of course, a lot of you here are current members using the system. So as Dave said, please use this. This is a value. This is a benefit for you and most of all for your patients and clients. So we are excited to get your feedback. So we are open to that. As Dave mentioned, this is V1. We're only going to continue to learn more and grow and improve in this feature. So excited to hear how you can use this and get started with the notes and templates feature. Cool.
In the interest of efficiency, then, we'll adjourn. Thank you, everyone, for attending. And if you have questions, just hit us up, support@headsuphealth.com. We'll be back next month. Topic to be determined, but we'll see you guys in a month. Thanks, everyone.
Sounds great.
Thanks, everybody.
Thank you guys.
Thank you.
Yeah.
Guys.